What is chronic pain? Chronic pain is pain that lasts a long time. In medicine, the distinction between acute and chronic pain is sometimes determined by the amount of time since onset. Two commonly used markers are pain that continues at 3 months and 6 months since onset, but some theorists and researchers have placed the transition from acute to chronic pain at 12 months. Others apply the term acute to pain that lasts less than 30 days, chronic to pain of more than 6 months duration, and subacute to pain that lasts from 1 to 6 months. A popular alternative definition of chronic pain, involving no fixed duration, is pain that extends beyond the expected period of healing. Chronic pain may originate in the body, or in the brain or spinal cord. It is often difficult to treat. Epidemiological studies have found that 8% to 11.2% of people in various countries have chronic widespread pain. Various non-opioid medicines are initially recommended to treat chronic pain, depending on whether the pain is due to tissue damage or is neuropathic. Psychological treatments including cognitive behavioral therapy and acceptance and commitment therapy may be effective for improving quality of life in those with chronic pain. Some people with chronic pain may benefit from opioid treatment while others can be harmed by it. In people with non-cancer pain, patients might try opioids only if there is no history of either mental illness or substance use disorder. Opioids for chronic pain should be stopped if they are not effective at treating the patient's pain. Severe chronic pain is associated with a decrease in the likelihood of survival over the next 10 years of a patient's life, particularly in patients with heart disease and respiratory disease. People with chronic pain tend to have higher rates of depression, but it is not clear whether the pain causes depression or whether depression causes the chronic pain. Chronic pain can contribute to decreased physical activity due to fear of making the pain worse. Pain intensity, pain control, and resiliency to pain can be influenced by different levels and types of social support that a person with chronic pain receives. Chronic pain classification. The International Association for the Study of Pain defines chronic pain as pain with no biological value, that persists past normal tissue healing. The DSM-5 recognizes one chronic pain disorder, somatic symptom disorders. The criteria include pain lasting longer than 6 months. The International Classification of Disease, 11th revision, ICD-11, suggests 7 categories for chronic pain. Chronic primary pain, defined by 3 months of persistent pain in one or more regions of the body that is unexplainable by another pain condition. Chronic cancer pain, defined as cancer or treatment-related visceral within the internal organs, musculoskeletal, or bony pain. Chronic post-traumatic pain, pain lasting 3 months after an injury or surgery, excluding infectious or pre-existing conditions. Chronic neuropathic pain, pain caused by damage to the somatosensory nervous system. Chronic headache and orofacial pain, pain that originates in the head or face, and occurs for 50% or more days over a 3 months period. Chronic visceral pain, pain originating in an internal organ. Chronic musculoskeletal pain, pain originating in the bones, muscles, joints or connective tissue. Chronic pain may be divided into nociceptive, caused by inflamed or damaged tissue activating specialized pain sensors called nociceptors, and neuropathic, caused by damage to or malfunction of the nervous system. Nociceptive pain can be divided into superficial and deep pain into deep somatic and visceral. Superficial pain is initiated by activation of nociceptors in the skin or superficial tissues. Deep somatic pain is initiated by stimulation of nociceptors in ligaments, tendons, bones, blood vessels, fasciae and muscles, and is dull, aching, poorly localized pain. Visceral pain originates in the viscera organs. Visceral pain may be well localized, but often it is extremely difficult to locate, and several visceral regions produce referred pain when damaged or inflamed, where the sensation is located in an area distant from the site of pathology or injury. Neuropathic pain is divided into peripheral, originating in the peripheral nervous system, and central, originating in the brain or spinal cord. Peripheral neuropathic pain is often described as burning, tingling, electrical, stabbing, or pins and needles. Chronic pain causes. Under persistent activation, the transmission of pain signals to the dorsal horn may produce a pain wind-up phenomenon. This triggers changes that lower the threshold for pain signals to be transmitted. In addition, it may cause nociceptive nerve fibers to respond to, generate and transmit pain signals. The type of nerve fibers that are believed to generate the pain signals are the C fibers, since they have a slow conductivity and give rise to a painful sensation that persists over a long time. In chronic pain, this process is difficult to reverse or stop once established. In some cases, chronic pain can be caused by genetic factors which interfere with neuronal differentiation, leading to a permanently lowered threshold for pain. Chronic pain of different causes has been characterized as a disease that affects brain structure and function. MRI studies have shown abnormal anatomical and functional connectivity, even during rest involving areas related to the processing of pain. Also, persistent pain has been shown to cause gray matter loss, which is reversible once the pain has resolved. These structural changes can be explained by neuroplasticity. In the case of chronic pain, the somatotopic representation of the body is inappropriately reorganized following peripheral and central sensitization. This can cause allodynia or hyperalgesia. In individuals with chronic pain, EEGs showed altered brain activity, suggesting pain-induced neuroplastic changes. More specifically, the relative beta activity compared to the rest of the brain was increased, the relative alpha activity was decreased, and the theta activity was diminished. Dysfunctional dopamine management in the brain could potentially act as a shared mechanism between chronic pain, insomnia and major depressive disorder. Astrocytes, microglia, and satellite glial cells have also been found to be dysfunctional in chronic pain. Increased activity of microglia, alterations of microglial networks, and increased production of chemokines and cytokines by microglia might aggravate chronic pain. Astrocytes have been observed to lose their ability to regulate the excitability of neurons, increasing spontaneous neural activity in pain circuits. Thanks for watching our video. Make sure you subscribe to receive more video related to chronic pain symptoms, chronic pain treatment, and many other everyday health and wellness. Thank you so much for watching.